Okay, we are ready to get started. Welcome and thank you for joining us for the Daré Biosciences virtual bus tour. My name is Janine Thomas. I am CEO of JTCIR and I will be the moderator for today's event. So we are excited to continue the virtual bus tour series with a Midwest stop. And for the format today, Sabrina Martucci-Johnson, she is President and Chief Executive Officer of Daré Bioscience, will take you through the Daré story. I will then open the event up for a Q&A and take your questions. So now it is my pleasure to turn it over to Sabrina.
Great. Thank you so much, and thank you for all of those of you tuning in today. So before I get started, definitely wanted to highlight that the presentation will contain forward-looking statements and risk factors about our business. So please do refer to our SEC filing for a full overview of the risks and uncertainties associated with our business. So for those of you who know us well, you may know that we're focused solely on advancing health for conditions that affect women. And it's a great time to really tune in and get to know us better because 2026 and 2027 are really two exciting years for us. So our portfolio is built solely on closing those therapeutic gaps in care using science that serves her needs. And in 2026, as you'll hear, we have two products that are commercializing for women. So we're going to talk about those. As well as in 2027, we have two products that are going to have really important data readouts. And what you'll see as we go through the portfolio is across the portfolio, whether it's our commercial products, which we strive to make available via all paths that we can leverage to make sure that we're getting these evidence-based solutions in the hands of women. So whether we're talking about a commercial product or we're talking about development stage candidates, what everything has in common is that clinical and evidence basis to the solutions. The other thing you'll see as I highlight the portfolio and our achievements and what we're doing on the research side is how we leverage grant funding to advance programs in our portfolio. Daré's portfolio is not built around a specific life stage or a specific product. Specifically, we're looking to, again, fill those therapeutic gaps in care wherever they may exist. So from contraception through to menopause, sexual health to fertility and infectious disease, we're closing those critical gaps in care using that science that serves her needs. And as I go through the talk today, I'm really going to focus on 6 of our programs. And these are programs that I'm going to highlight because they're the programs that are commercializing, like Fluorescent LF5 and Dare Sildenafil Cream. Or they're programs that have clinical data readouts, like our Dare HPV program and our Ovaprene contraceptive program, or like our estradiol progesterone 28-day vaginal ring. It's something that we're looking to commercialize next year. Or like our Dare PTV1 program, it's something that we're looking to get into a phase 1 study supported by grant funding. But before I go into the portfolio in more detail, I really want to take a minute to talk about why women's health and why now. We really love working in this category for a few important reasons, apart from the important mission of our work. But from a value perspective, what we like about this category is really 3 important pillars that make it so exceptional. One is, despite the disproportionate lack of funding that has gone into women's health, where women's health only receives 1 to 5% of private healthcare investment, if you look at products that actually generate over $500 million in annual revenue, 27% of those are in women's health. So it's been a disproportionately accretive category from that perspective. Second, women's health is interesting because so many of the areas where there are therapeutic gaps are not really diseases in a traditional sense, but these are things that women are likely to experience throughout their lifespan, whether it's thinking about contraception, going through a pregnancy or fertility, going through menopause, sexual health that can be impacted by hormonal shifts and life shifts. So that makes it really compelling with those large categories that everyone is affected. And then also because there hasn't been as much investment in the category over the years, and women weren't even required to be included in clinical research until 1993, there are a number of conditions that are quite serious that don't have any pharmaceutical solution. So think about high-risk HPV infection. It's the virus that causes cervical cancer. 6 million women acquire that infection every single year, and yet there's no FDA-approved product to treat that infection. And then the third thing that we find so compelling about this category from a development and investment perspective is the amount of grant funding that's available. And we've really leveraged that across our portfolio and from different types of grant makers, whether it's the Gates Foundation or government agencies like ARPA-H or NIH. Across our portfolio, including our late-stage programs, we've really leveraged that grant funding to advance our portfolio. And another highlight before I really get into the products is the white space we're filling. There's a lot of conversations happening about women's health, and that is fantastic, but the medicine is not keeping up with the conversation. And many of the options that are available to women today are just not built on science, right? They're marketing language versus actual trials. And so what really distinguishes our products and us as a company is that it's a portfolio built on science. So all of our products go through clinical development. Our proprietary products are protected in terms of novel formulations and development and delivery technologies. And then we're making sure that women have access to them wherever they're getting their care and wherever they're seeking solutions. So whether they're going to a brick and mortar healthcare provider, they're participating in telehealth, they're searching for products online, we want to make sure that our products are directly available to them wherever they are. So let me dive right into that purpose-built portfolio. So first of all, I want to talk about Fluorosync LF5 because this is live and on the market now. This is a vaginal probiotic. So we might have heard of probiotics in the context of gut health and the gut microbiome, but the vagina has a microbiome as well, and it can be very easily disrupted from antibiotics, weather, activities we participate, hormonal shifts. So a lot of things can disrupt that vaginal microbiome, and when a microbiome in the vaginal environment is disrupted, it can lead to things that women experience and will notice in terms of changes in discharge, changes in odor, changes in comfort. And so a probiotic can really assist with that. The vast majority of the probiotics that are available today for women are gut strains for the stomach that are delivered orally. So those are not really optimized or delivered to the vaginal environment. And that's where Fluorosync LF5 really shines. This is a probiotic that was specifically developed with strain from women, their vaginal microbiome, who've never experienced a yeast infection. And it's been clinically studied and backed by over 30 years of research. And in a 100-person clinical study demonstrated that 96% of women achieved that vaginal microbiome balance within just 3 days of one-time use each day of the product at bedtime, and 90% maintained that balance 2 weeks out. So it's available now on the Daré Health Hub. It's $49 for the box, and the box comes with 2 courses. And that's really purposeful. This is something that we think women can incorporate into their vaginal wellness routine and really start to think about a vaginal wellness routine. It's available right now exclusively on the Daré Health Hub, but we are actively looking at some other channels, including clinician offices, as well as other retail channels for the product. So more on that to follow. Daré Place Sildenafil Cream is a prescription product that is a first of its kind arousal cream for women. It has been demonstrated to increase general blood flow within just 10 to 15 minutes of application and to improve arousal sensations. And that's been demonstrated using clinically validated and FDA-reviewed endpoints. There's really nothing else out there that's available on the market today that has been clinically studied and designed specifically to do this for women. We're making it available as a 503B compounded product. And what that means is it's manufactured at a 503B facility. It's not yet FDA approved, but it's manufactured at a 503B facility that does register with the FDA, is subject to FDA inspection, and is required to manufacture the product under the same quality manufacturing standards called good manufacturing practices that pharmaceutical products are required to be manufactured to. And they are looking to make this product available later this quarter and start dispensing. And I say start dispensing because prescribers are already writing prescriptions and women are already going through telehealth so that their prescriptions are in the queue so that as this product starts dispensing, they can be the first to get this product, this first of its kind arousal cream for women. And it's available. It comes in a tube. The tube is $99 and it has 10 doses in the tube. And it's just used on demand for sexual events by women. So we're very excited to make this available this year. And I want to talk about something that really distinguishes Daré in terms of how we can leverage our commercialization strategy for these products, because we're leveraging the clinical relationships that we built through product development. There are not many companies innovating therapeutic prescription products in the women's health space, unfortunately. And so Daré has really stood out in that regard in our clinical development over the last 10 years. And we're really able to translate those clinical relationships into now really a commercial advantage, because those providers provide peer-to-peer education about our product. They become prescribers for our product. And as our portfolio continues to expand, it is even more opportunities for us to have that kind of level of provider engagement, because these products really speak for themselves. And in terms, though, of as we think about getting our products to market in that really unified women's health ecosystem, it takes those provider relationships. Those are so critical. But as I mentioned up front, we want to make sure that wherever she's getting her information or her care, she's going to have access to our products. So in addition to healthcare providers that have clinical practices in office, it's also really important that we're working with healthcare providers with a telehealth infrastructure, right, that has national reach. And those prescribers can become very important in terms of integrating new products like these into their recommendations and prescribing habits for the women that they serve. We also want to make sure that we're really leaning into a digital native strategy. So a lot of people are getting their information online, and there's an opportunity for products like this that are clinically and evidence-backed solutions for us to work with really healthcare provider influencers. So think about influencers, but think about influencers that are clinicians, that are healthcare providers, that are institutions that put out information for consumers, like the Menopause Foundation. Those kind of organizations are great for us to really leverage as we work to get the word out about our products, because they're trusted sources of information and they're looking for trusted products that they can talk about for the people that follow them as well. And then in terms of where people can get the products, it's really important that we have a central patient destination that is designed for them and for fulfillment there. So that's our Daré Health Hub, and it's really our central commercial platform. So we work with Medvantx Pharmacy. They really support all the logistics on the back end. And on the Daré Health Hub, women can get access to our prescription products as well as our non-prescription product. So Daré Bioscience cream or Fluorescent LF5. They can link to get more information about the products. If they don't have a prescription, they can access telehealth that is serviced through Medvantx. And it allows them to also get information across our products. And then on the back end, it's where prescribers can submit their prescriptions. Medvantx is a central mail order pharmacy. They show up in most electronic medical record systems automatically. So it's really seamless. So for both the provider experience and the consumer's experience. I want to now highlight a few things that I mentioned up front from the development timeline. So the first is Ovaprene. So Ovaprene is a first in category non-hormonal vaginal contraceptive. It is a once a month non-hormonal contraceptive. There's really nothing like it available today in the contraceptive category. The closest product that has existed to something with a form factor like Ovaprene, that once a month form factor vaginal, is NuvaRing, which is a hormonal product, but when it was still branded, it peaked at almost $1 billion in annual revenue. So Ovaprene was really designed to similarly be a once a month vaginal product, but to work without hormones. So it has a physical barrier and a chemical that it releases, which is a spermiostatic agent. It's in its pivotal phase 3 registration study. So this is the study that would be used to submit to the FDA. So far, it is performing exactly as predicted. We've had 2 now positive independent data safety monitoring board meetings, one last summer and one this summer. And in both cases, the typical use effectiveness based on the pregnancy rates being seen is continuing to perform in the projected range, was to 86 to 91%. The adverse event profile has been very consistent throughout the trial as well. And as I mentioned, it has the potential to be the first FDA-approved product of its kind. So right now, based on where we are, we're expecting to complete enrollment to achieve our target of 2,500 cycles of data to evaluate. We expect to complete that enrollment this year and to have those data available and a top-line data readout in 2027 for this product. The other development stage product I want to talk about is Daré HPV, which is our product that's designed to treat human papillomavirus infection. So human papillomavirus infection is the virus that causes cervical cancer. And despite the fact that we know the virus that causes cervical cancer, there are no FDA-approved products to treat that infection when a woman tests positive. Instead, she's told to just wait until that infection can lead to cervical lesions or precancerous lesions or even cancerous lesions, which then have to be surgically removed from the cervix. And so Daré HPV is really designed to be taken right when she has that persistent high-risk infection instead of waiting for her to get those precancerous lesions. So it's in a phase 2 trial right now. That trial is funded by ARPA-H through a contract grant funding mechanism we have from ARPA-H. And we expect to have top-line data from this trial in 2027 as well. And then in terms of what's coming down the pipe next in terms of prescription products on the commercial side is we're working to do the same thing with our Dare to Reclaim hormone therapy intravaginal ring as we've done with Dare to Place Sildenafil Cream, which is make it available as a 503B compounded product while we continue activities that would continue to work to advance it through an NDA pathway. And so we're targeting to have this once-a-month hormone therapy product available for commercialization late next year. Menopause is definitely having a moment. There's more conversation about menopause, but unfortunately for women, there is still no product available to be prescribed today that is clinically studied and actually follows the Menopause Society guidelines for menopause hormone therapy, which is if it's a woman with a uterus, both progesterone and estradiol together in one product that is non-oral. And that is exactly what our estradiol progesterone intravaginal ring once-a-month product is designed to do. So looking forward to keeping you updated on that. We're actively looking at activities to also support non-hormonal products for menopause, and specifically the genitourinary syndrome of menopause, which can lead to sexual pain and discomfort. This is a really important side effect that women going through a breast cancer hormone receptor-positive breast cancer therapeutic regimen may experience, and yet hormonal products are often not recommended for them. So this is a non-hormonal solution that the FDA has cleared for us to start preparations for phase 2. And then the last one I wanted to highlight is our vaginal ring technology with progesterone only. So same kind of technology as we talked about for the hormone therapy product, but progesterone only for IVF support as well as investigational product for preterm birth. So those are places where progesterone injections or other vaginal forms of progesterone are often used. And this is a very convenient vaginal ring that can release progesterone over several days. And we do have support from the NIH to start a phase 1 trial with this product. So we're in preparations for that. So more on that to follow. We have an extensive preclinical pipeline, most of it supported by grants and outside funding. Similar first-in-category opportunities that as they advance, we look forward to keeping you updated on. A couple of highlights from a financial perspective. Our last reported cash balance was $18.5 million. The management team at Daré is highly experienced. There are people that come from both experience. We have a team that's experienced both on the clinical development side as well as the commercialization side, and women's health specialists as well as general pharmaceutical specialists, which are important in the development programs that we have. And then I want to end with a couple slides just really highlighting the near-term catalysts and why Daré, why now. So in terms of things to watch for in the coming months and year, first of all, obviously there's 2 commercial products that are going live this year. Daré Sildenafil Cream for arousal and our Daré Restore Fluorescent LF5 vaginal probiotic, which is available now. Both of those are available on the Daré Health Hub that you can get to by just going to our website, darebioscience.com. And then we've got the Ovaprene non-hormonal contraceptive clinical readout and the Daré HPV clinical readout next year. And then we're working to get that menopause hormone therapy vaginal ring commercialized as a 503B compounded product next year as well. So stay tuned for that. And I'll just end on the, why Daré, why now? I started the talk today. We're really highlighting it's a great time to get to know us. This is 10 years in the building. Getting to this point now where we are going to be commercializing 2 products directly, one prescription, one not, really looking at all the best ways to get products in the hands of women as quickly as we can. We've got that late stage pipeline advancing with that non-dilutive funding, with those clinical readouts next year that are also so important. And then all of it is backed with this really scalable commercial platform in place through our Daré Health Hub and the infrastructure we're building both internally and with our telehealth partnerships to support scalable growth. So with that, I will open it up for questions, and thank you again for listening in today.
Great, thank you. So to our audience, if you have a question for Sabrina, click the Q&A button at the bottom of your screen and type in your question. So we already have people that are familiar with this process. So we have some questions in queue already, Sabrina.
Great.
Right. So can you provide an update on the NASDAQ delisting process and whether we should expect any positive development or clarity on retaining the listing?
Sure, absolutely. I mean, obviously this is important to us and it's something that we focus on. So the way the process works is basically we were able to request a hearing in late July. The panel, NASDAQ grants those hearings within 30 to 45 days from the request date. At the hearing, we really go in and present our plan for compliance, which is obviously very important to us. And so we present that plan for compliance, and then typically the panel takes about 30 days to respond to that plan that we put forward. So we are in preparations for that. We work with strategic advisors to help us prepare for that. It's something very important, and we're remaining focused on that. And obviously all the things we're doing in terms of the products that are launching, all of that, our clinical data, that all becomes a very important part of the narrative that we share with the panel for our compliance strategy and plan as well.
Great. Okay. Our next question. It feels like you have a unique commercialization approach. Can you describe the rationale further and also discuss how your commercial team is comprised?
Yeah. So in terms of the rationale for the commercial strategy, so a few of us on the team have backgrounds in pharmaceutical launches. Historically, myself included, I spent the first part of my professional career on the commercial side. And as we think about kind of where the world has shifted and where we are today, we really saw an opportunity to lean into where people are getting their care, where they're getting their information, and how they want to access their products and how they want to pay for their products. And, we've seen with telehealth, right, the rise of telehealth, the rise of mail order pharmacies, even before telehealth was a thing. I would say the larger proportion of people that are really interested in cash pay for products, so that as long as they're reasonably priced and that they don't have sometimes the complexity and the burden of the prior authorizations and the insurance that they're going through. There are just a lot of things that have shifted. And also, as I mentioned up front, kind of where are the trusted sources of information? Healthcare providers are important in terms of those actual office visits, but the other really trusted source of information about products is healthcare providers that have that digital platform online, right? Whether it's a podcast or again, Instagram, Facebook, whatever they're doing, TikTok. And so we really wanted to lean into that. I mean, that's where women are getting information. That's where women are getting their products. And because we have products that are actually backed in with science and clinical evidence, it opens up all of those channels to us. We don't have to rely on advertising, and spending that way to get a consumer to try something that doesn't have any data behind it, because we can't go to a healthcare provider, right? We can actually go to those trusted channels. And so that's really what's behind our strategy. And we think it's a more cost-effective strategy that we can leverage. And so we have internal staff. We don't have like the traditional big pharmaceutical sales organization. Again, we're just believers that that's not required anymore. Times have changed. We obviously do have professionals who can obviously interact with and really be a partner to the healthcare provider community to make sure they have the information they need, that can partner and enter into relationships and partnerships with telehealth platforms or other organizations that we're going to partner with, and then also to support us in our outreach and our implementation of our digital strategy, which is really leaning into, again, podcast, professional influencers. And when I say professional influencers, I mean like healthcare providers, clinicians, et cetera, who are influencers.
Got it. And we do have a couple of questions that are financial related. I know that you have not reported your second quarter results, so I think maybe we hold off.
Yeah, so stay tuned.
Yeah. I just wanted to make sure that we were aligned there. I know it's to have that conversation when they haven't been reported. Okay.
Yeah.
Okay. The next question is, what portion of development spending is expected to be covered by grants or partners rather than Daré's cash?
Yeah, so we're really right now prioritizing our development programs that are either 100% grant funded or very significantly grant funded. Those are the programs that we're really prioritizing now from a development perspective, because then that requires, minimal contribution on our part, or not as material of contribution on our part to support those programs. And so strategically, that's what we're doing. So right now it's Ovaprene, which is in phase 3, which is, we historically had a collaborative research agreement with NIH, and then more recently had funding also come through from the Gates Foundation. So we have had some contribution historically to that program. We'll have a little more budgeted, to get through the end of the trial as well, but it's very, very heavily grant supported, as you can tell from the financials. The Dare HPV program, which is 100% supported by both a grant from ARPA-H as well as NIH. So that's completely grant funded. The Dare LARC1 program, which is preclinical, which is completely grant funded. We have another non-hormonal contraceptive development program, which is completely grant funded. Our Cassia S implantable contraceptive is 100% grant funded and is going through phase 1 right now. And then we're looking to get our Dare PTB1, which is our progesterone vaginal ring, into phase 1, and that's funded with a grant from the NIH. So those are really the development programs that we're focusing on, because they either have 100% or very, very, significant grant funding to support them, so that our contribution is not significant.
Okay. Next question. Does My Menopause RX direct eligible patients back to Daré, or does it prescribe, fulfill, and ship directly to the patient?
Yeah, great question. So it's a great example of the kind of, relationships that we're really prioritizing with those kind of digital health platforms, which is they prescribe the product, right? And that, which is what they do best. They prescribe products for their patients, and when they prescribe it, they can access it right through their electronic medical record system. It goes right to the Medvanix pharmacy that we work with, and then that fulfillment can be handled centrally. So it's just a super efficient channel. It leverages the logistics, the pharmacy, fulfillment, which, by the way, includes all the things we're also used to having, right? The pharmacy texting us when our prescription's ready, when it's coming, when is it time for a refill, right? So it gets to leverage all of that back end that we've built through Medvanix, but they're educated about our products and know about our product and know how to prescribe it, so they're ready for their patients. But it's so helpful for us to have that relationship with a trusted, a truly specialist in women's health, so that when women come to our platform, and are looking for not just the asynchronous telehealth visit, which we offer, which is great. Like if you know you want Dare to Play and you are ready and you want your prescription, it's fantastic. It's a 10-minute asynchronous questionnaire. But sometimes we want more than that, right? We want a visit. We want to talk about other things. We want to have an interaction with a healthcare provider. It's so hard to find a healthcare provider that is truly expert in this case, menopause care, but also is not like peddling a bunch of products that they made themselves, right? That is going to provide clinically backed solutions. So those are the kind of relationships that we love and want to enter into more of. It's a win-win.
Perfect. Our next question, what is revenue guidance for the current year and next year?
Yeah, we haven't provided any guidance yet, but what I will say, because it's early, right? We're in early days of the Fluorescent LF5 launch, and the other place that for cream hasn't dispensed yet. But what I can talk about, or what are some of those key performance indicators that we're going to be looking for? What are we watching in the launches, right? So when I think about either Fluorescent LF5, which is non-prescription, or Dare to Play sildenafil cream, what we're going to be watching for from the consumer perspective is where did she come from, right? How did she get to that product, right? So we'll be watching to understand that, where did she come from? And then what is her use behavior, right? How often does she use the product? How often does she reorder, right? So that we can understand on the average kind of woman perspective and based on where she comes from, how is she using the product? How is she incorporating those into her routine? From the provider perspective, we're going to be looking for, are they stocking the products, right? And if they're stocking the products, are they, dispensing more frequently than maybe someone that's not stocking the products? Are those different behaviors? What are the repeat prescribing behaviors at a prescriber? We want breadth of prescribers, but we want depth, right? We want to see that a product has been integrated into their clinical practice, so they're writing repeat prescriptions. That's super important. So those are the kind of things that we're going to be looking for in the early days of launch. And all of that really feeds into us being able to understand customer acquisition costs and what are our most effective channels, so that those can be the ones that we're reinvesting in.
Perfect. I have a question. You had talked about, your different approaches, using social channels in really innovative ways, and, trusted ways of really doing your marketing. So, being science-based and having real solutions for women, do influencers come to you? Do, the telehealth providers come to you
Yeah.
I would imagine.
Yes.
Yeah, I would imagine they would, because there's not a lot of credible sources for solutions for women out there, that are science-backed, that have, the standards that you apply to your products. Yeah,
thank you for highlighting that. They absolutely do. It goes both ways. There are people that we seek out, right? Because, we want to make sure they know about what we're doing and what a fit we may be for what they're doing. And we want to make sure they have the information they need. And then also, right, there are people that reach out to us and say, we'd love for you to be on this podcast, or we'd love to, can you provide us just some materials so that we have nice images and, right, things to share on our platforms, because we really want to make sure we get content out about this. So it goes both ways. And that is one of the things that I think is distinct here, right? We're not having to rely on having to buy our way, 100% buy our way into the consumer's mind, right? There's part of that. You need to build awareness, right? But we're able to do that through earned channels because of the work that we've done.
Great. Our next question, what is the expected timeline for completing enrollment in the Ovaprene phase 3 study and reporting top-line results?
Yeah, so we're targeting to complete enrollment this year. We're already in August, so there's not a ton left of this year, but this year. So we are targeting to complete enrollment this year. We haven't given, we're watching the numbers. So what we're really working towards is getting to a number of women where we feel very confident that we will have ultimately 2,500 safety cycles when we end up completing enrollment. So that is what we are looking for. And so, we had shy of 2,000 cycles when we did the interim data safety monitoring board meeting back in May, so not too long ago. This year. So that's the number. So we expect to complete it this year. We haven't said specifically when. And then remember, we follow women for up to 13 cycles. We don't have to follow them all the way through 13 cycles. And, they don't all make it to 13 cycles, but up to 13 cycles. So that's why we said top line data will be 2027 by the time we get there.
Great. A lot of questions from your Midwest attendees here. Another question is, do you expect additional telehealth partnerships?
Yeah, so we are, we're talking to a number of organizations. Some are going to be ones that we're really going to highlight on our website because they rise to the level where we want to make sure, they're on our website and easily kind of linked to. And that doesn't mean that if they're not on our website, they aren't as good. It's just sometimes that just makes more sense than others depending on the situation. And sometimes they may not be, but they're organizations that we've done all the right. They're a telehealth platform where we've done all the training with their healthcare providers, which is a really important step to just make sure they are aware of the products, they incorporate them into their kind of practice guidelines and behaviors, and they know they have us in the system for prescribing. So sometimes you'll see them as formal things we announce, and sometimes, you won't, but they're behind prescriptions that are coming in.
Correct. Okay. Next question. What are the current priorities and mandates of your commercial organization?
At this point in the launch, it's really around awareness, product like trials, writing, right, getting those use experiences and breadth of that, right? So making sure that people that should be aware of the product are aware of the product, making sure they have all the information they need to prescribe the product if it's to prescribe, or share it with their patients if it's like fluorescent LF5. And then making sure that, again, the channels that we should be pursuing, that we have all of the procedures and materials and processes in place to support them. So whether that's stocking in clinician offices, whether that's retail channels that we're looking at for fluorescent LF5, those are the priorities right now.
Okay. We'll have one last question here. What early indicators should we watch to judge whether your consumer commercial strategy is gaining traction?
Yeah, it's really going to be all those things I've talked about. So specifically, I'll talk about fluorescent LF5 and I'll talk about Daré because they're a little bit different. With fluorescent LF5, it's really around, we're looking at, just orders, magnitude of orders, repeat buying behavior, and then also where those are coming from, right? Which are our most efficient sort of routes to getting those orders. On Dare to Play, we're going to also be looking at telehealth. So remember, we have telehealth available on the Dare Health Hub, and we have these other telehealth channels. So we are going to be looking at those distinct from what I refer to them as brick and mortar providers, but providers that you're visiting in an office somewhere. So we are going to be looking at those metrics very closely because the telehealth metrics are going to be more of an indicator of a little bit more of a direct to consumer kind of awareness than the traditional kind of brick and mortar healthcare channel. So those are things we're going to look at, specifically the telehealth on the Daré Health Hub, because that will be driven solely by consumer awareness.
Excellent. Any closing remarks, Sabrina?
I just, again, appreciate the questions today. Fantastic questions and opportunity to share a little bit more about what we're doing, and, look forward to continuing to provide updates.
Excellent. So with that, this does conclude the Midwest stop on the Daré Biosciences virtual bus tour. We look forward to seeing you at the final stop on the East Coast happening August 26th. And with that, this concludes our session, and we wish everyone a great rest of your day.
Awesome. Thanks, everyone.
Thank you.